This conference will now be recorded.
Hi, everyone. Welcome to November's VCP Networking Call. Today we have an awesome topic that Mary is going to lead us through. I'm Heather Camper. I'm with Veteran Community Partnerships. I'm the community co-chair, and I'm just going to be running the chat and the tech as always. And I'll start us off with introductions, and then Mary will take it from there. So I introduced myself, but I'm with the Denver Regional Council of Governments and our Area Agency on Aging. Courtney, can you introduce yourself?
Yes, hi everybody. My name is Courtney Bowers, and I am the VA VCP co-chair along with Heather and the VCP coordinator. So glad everybody could join us today.
Julie? Oh, we can't hear you. There you are.
This is all new for me here. I'm used to not having, but we've got 3 people working at home, so this is what we have to do to make it work. I'm Julie Maxson. I'm with Dignity Hospice, the Director of Community Partnerships. Nice to meet everybody.
Awesome. I know, Julie, you're on a lot of our calls, but I've never seen you. Hello. How about Katie Civiletto?
Hi, my name is Katie Civiletto. I work with Give an Hour, part of a national nonprofit that offers no-cost mental health services for military veterans and their loved ones. And then I'm also on the steering committee for VCP.
Thanks, Katie. Leslie, you're up next.
Hi, everyone. My name is Leslie Mader, and I am the Strategic Account Executive for Colorado for InnovAge, and we try to serve veterans throughout the state. I'm so excited to be here.
Thanks, Leslie. Maria?
Good morning, everyone. I'm Maria Callis. I'm the veteran point person at the Denver Hospice, and I'm having some problems with my video this morning. Sorry.
No problem. We do the best we can. That's my motto these days. Brian, can you introduce yourself?
Yeah, sure. Hi, everybody. I'm Brian Stice. I'm a psychologist with VA Eastern Colorado. I'm in the position of local recovery coordinator. Part of that role is having involvement as the liaison for mental health service for community organizations. And I'm also happy to be on the VCP steering committee.
Thanks, Brian. And then Colleen, if you wouldn't mind introducing yourself one more time.
Sure. Colleen Cronin. I work with the Healthcare for Homeless Veterans program, the Grant Per Diem program.
All right, Mary, I think that's everyone. If you want to take it from here.
Is there another person on the phone, it looks like? Looks like you have 2 people on the phone.
I think it might be
Probably
Courtney.
me, Mary. Yes.
Oh, okay. Okay, perfect. I just wanted to make sure we got everybody. Hi, I'm Mary Volenec, and I've been in the Denver nursing community for about 30 years. And in the last, 3 or 4 years, I've connected with veteran healthcare, veteran hospice, the VCP steering committee, and so forth. And I am very excited today to talk about some of our caregiving challenges and family caregiver resources that we have. One of the things that, as I was going through this and looking at materials, one of the things that really kind of hits home, and I think it hits home for all of us because we're not living in a bubble, is that the people who care for the people we care for, you know, the family caregivers, the neighbor caregivers, even the hospital staff and the clinic staff and the social work staff and then the other community outreach staff that care for veterans, everybody is in the position of a caregiver. And during COVID-19, these caregiver roles have been so severely delineated. And by this, I mean that when your loved one who you're caring for instance, if that person has to go to the hospital, you may or may not be able to visit them. You may or may not be able to have influence on the experience that you have or the experiences that they have. I, for instance, am a caregiver for a gal who she went to the hospital after having a series of falls, and they wouldn't let anybody visit. She could talk on her phone, but she was so confused. It was really difficult to make the inroads there to figure out what was going on. So we finally got her home, which was great. And then getting people to come in as ancillary care providers for her was difficult because they didn't want to be exposed since she was in a high-risk situation being in the hospital. So then she was without caregiver support for a couple of days, and it just, it's just kind of this big snowball. And so I would like to talk about that a little bit and find out what your experiences have been here. There are different reasons why people become caregivers. Sometimes it's just love and devotion and obligation. Sometimes they don't have the money to pay somebody else or to have somebody kind of help in that. Sometimes it's pride. A lot of times people I don't want strangers in my house. How many times have we heard that, right? And so that's all well and good when one person's had a stroke and another person's trying to take care of them, and the person who's had the stroke says, don't let anybody in my house, and the caregiver is, falling over backwards with the weight of this caregiving responsibility. And so how do we address that during this time? I found a couple of resources that I'd like Heather to share with us. I just put a little one-sheet kind of resource list together, and this may be some resources that you already know about. The VA, of course, has fabulous resources. There you go. So there is this wonderful 44-page booklet called the VA Dementia Care Team Resource Guide, and I put the link for that there in the flyer, and I think Courtney or Heather, somebody's going to hopefully send that out to the participants on this call. So if you could make sure we had your email address in the chat box, that would be great, so that we can make sure you get a copy of this. But the VA Dementia Care Team Resource Guide is so comprehensive. It has everything from explanations about what terms mean to potential benefits for our VA participants and other resources that thank you for pulling that up. That's great. Yeah, it's got like a little place to keep notes on it. It's got different hyperlinks if you have it electronically instead of printed. There's a lot of hyperlinks. I did try some of the hyperlinks today, and I had to actually type in what I thought it might be on the VA site because the hyperlinks weren't current. So just kind of so you know about that. But you see through this table of contents here, it does talk about a lot of different programs that can help support our veterans during their need for more caregiving. And so that's this. And like I said, it's a 44-page document. It really is well written. It's very simply written. It's not dumbed down at all. It really has, I just think it's really well laid out. It's easy to read and easy to find what you need on it. So that's kind of a cool thing. And then, thank you. Perfect. And then from Given Hour, Katie Civiletto is our Given Hour representative who's here on the call today. Thank you, Katie. So there's information related to caregiving that can be found on their website, and that is there. And then there's this small guide, which is the second hyperlink there, that can help you as a caregiver or help you pass on to people that you know of as caregivers, kind of cope with some of these things that caregivers have to deal with. Is the link working?
Sorry, my computer's slow when I run these meetings.
Well, that's okay. You're probably taking up all your
I'll try to pull up.
Well, that's okay. That's okay. They're hyperlinked too, so when you guys get the just that little one-page handout, you can electronically go to those sites too. The third on this list of resources that I put here are the AARP resources for family caregivers, and that's really just available to everybody. But you know, AARP has a wealth of information. They've got lots of money, and they do grant-funded research projects, and they create booklets, and they do a lot of community work. And so that really, you know, just to be reminded that AARP has a lot of really good resources. And I do know that family caregivers are not just caring for those who are 65 or older. There are a lot of people who require care who are a lot younger than 65. And, you know, there are resources out there for lots of different populations. There are some websites, though they say they're a .org. They may charge a fee to access their information just to help support their activities and so forth. So you absolutely can get, if you're on the internet a lot, you can go down rabbit holes about that. Now, there is a relatively new book, and that's called Creative Care, A Revolutionary Approach to Dementia and Elder Care. And this is Ann Basting. She also did a TED Talk, and she talks about how a fellow with dementia can communicate through his body movements, though he cannot communicate through his words. And it just is beautiful and inspiring. Again, there are a lot of books out there. I would love to hear about some resources that you have found particularly helpful or exciting. And that's pretty much what I have to say about this resource list. I'd like to kind of open it up and see if there are other resources that the participants on this call would like to share.
Y'all should be able to unmute as you need, just so you know. So let me know if you're having trouble.
Mary, I can speak briefly to the expansion of the VA Caregiver Support Program. I did put the link there in the chat for people to download the fact sheet with the new criteria. There's also a toll-free number you can call to reach the Caregiver Support Coordinator based on whichever VA is the closest to the person. Up until recently, it was post 9/11. And then with this new expansion of the Caregiver Support Program, which was part of the VA Mission Act, they've expanded it, and they're going to be doing it in different waves. But as you can see in the fact sheet, they're now opening it up to veterans that have incurred or aggravated a serious injury in the line of duty on or before May 7th, 1975. So that's like one of the new aspects of the Caregiver Support Program. And then I do believe that they're going to expand it beyond that, like over the course of time.
That is a beautiful document. And it looks like on the second page, it's got some resources there too. Perfect.
And I think one of my big learning points on this program was, there's the stipend and there's a financial benefit, but then there's all the support and resources for caregivers otherwise. And I'm gonna mix up the lingo a little bit, but that's true, right? The financial benefit is starting to expand, but everyone has access to kind of the caregiver support program.
That's the way I understand it. Is that right, Brian?
I might have missed your question. Heather, were you saying that based on like who would be eligible? Is that what you're wondering?
Well, just that I think in the community we might not understand that there's a financial stipend that's associated with this, or stipend might be the wrong word, but there's a whole host of like support services that are not related to that financial piece, and those two have different criteria. Is that right?
I'm not positive. I don't know. I'm not positive on that. I guess
And that's okay.
my guess is that if someone qualifies and they're eligible, then they would be sort of accepted into this whole program, where it would include funding and then other resources and services. Could always double check with the local coordinator to be sure. But yeah, the thing that I'm most familiar with would be the stipend piece, which is what most of the families are, really interested in that part.
Right, and we don't expect you to know all things all the time, Brian, about VA. You often do, but
I do my best. I know. I don't know if Courtney or Colleen, if you know more about that.
I don't. I took just the training course that's been required with the update of the caregiver program, but off the top of my head, I can't think of specific details, and I think they're still working some details out as well. But I think that the link that you provided, Brian, would be the best way to go about getting any kind of update. Yeah.
Is there a dedicated staff person now at Rocky Mountain Regional kind of zone for caregiver support?
Yes. Actually, hold on, let me get out of the screen. I can send you all the information that I received from the Caregiver Support Program group because of this, it being National Family Caregiver Month. So I can forward you that. It has all their contacts. And they also have a list of calendar events, virtual events that they're hosting throughout the month of November, which is included in the most recent November VCP newsletter. But if you did not get that for some reason, you can email me, and then I'm happy to send that out.
Well, that is terrific. Thank you, Courtney. Thank you, Brian, for those two. I'm out here in Hawaii, and I was talking to one of my hospice partners out here. I've been doing a lot of, kind of community outreach and talking to different people. And the gal at the hospice said that because in Hawaii there were 26 COVID deaths at the veterans home, that people really are very hesitant to send their loved ones to the veterans home. And even though it's been remedied and changed and things like that, folks who were kind of falling down to begin with now have this extra weight of what's the best thing to do for their loved ones. And I wonder, Leslie, if you could maybe speak a little bit about how InnovAge is taking care of that same issue in Colorado.
Thanks. No, I'd love to. I wanted to mention, I can tell you a little bit about what you just asked, but I did want to mention that this caregiver program, I was on a Zoom call. I think Heather and Courtney, we were all on that. I don't know if that was I was going through my notes. That was about a month ago, where we talked about this new Caregiver Act. And I think it's really wonderful that the VA is doing that. Something that InnovAge can offer, though, is that we have a special agreement with the Veterans Administration for folks that meet our 4 criteria of enrollment into our program. They have to be 55 and older, live in our zip codes, be safe at the time of enrollment, and then meet the functional requirements of at least 2 ADLs. If there's a veteran that meets that and perhaps is not Medicaid eligible, but is the VA payer agreement that we have, is somebody who is 70 to 100% service connected. So how we're different is that we are going into people's homes. We have runners that go out with a cleaned, sanitized iPad, show them how to get onto it. They have their primary care appointment through telehealth. They get their medications delivered. We're still providing respite care for caregivers, so they can still be placed into an assisted living or skilled nursing if that's what they want to do, but we try to keep people out of there. We're doing sitter services when called for to help. You know, when COVID was not around, our program was awesome because it's center-based, right? And so that gave caregivers 5 days off where they could go, make sure their loved one was taken to our center, and then they could be there for 6 hours and really give them a break. So we are case by case trying to help provide extra sitting services and more home care when necessary to help support folks. But I think because we used to be center-based, now we're community-based. We've gone out and are doing everything. We're doing physical therapy in the home, still doing light housekeeping, bathing. I know I'm forgetting something, but anyway, it's all home-based. And the other piece, just to let you know, even though we've had more spikes of COVID in the Denver metro area, we are starting kind of a reopening plan. And one of our centers, specifically in Thornton, is going to be the guinea pig. We're going to be trying maybe 10 people in one day. They come separately in a van. There's no socialization going on, but they'll walk in one direction in and out of our building and go to their primary care appointment. And if that's successful and we keep people safe and no one's getting sick, then we'll add probably the rehab services piece and then eventually the dental. So we're trying to do that step by step and trying to keep everybody safe at the same time.
Nice. Do you also have caregiver support, Leslie?
We do. Thank you for saying that again. We have social workers that are doing online support groups for their loved ones or for the loved ones of our participants, and even calls. We have mental health counselors that will work not only with our participants, but if some issues with the family, they'll work with them as well.
That's terrific. Thank you. Does anybody have any questions for Leslie?
The other thing I wanted to mention about the VA, we actually have a PACE liaison that's embedded in the VA. Her name is Nikki Garrett. Many of you know her. She calls monthly with one of our staff members to talk about people from the VA that are veterans that are enrolling, those that are VA payer, those that are Medicaid eligible, but that have identified as somebody who would benefit from our services. So it's very coordinated. And so I speak to Nikki a few times a month and email all the time. So we're trying to kind of keep growing that relationship.
Yeah, I'll jump in next. So Heather Camper with Dr. Cog, Area Agency on Aging. And kind of Mary, one thing that made me want to talk next was your comment about long-term skilled facilities and assisted living. And it is really, really rough. Dr. Cog, for those of you who don't know, we are the designated long-term care ombudsman program. So we have, I want to say 14, 15 staff who are designated to be essentially the advocates for those living in assisted living and skilled nursing facilities. And so they're, constantly working with families right now and caregivers who want access to their loved ones and want to be those ears and eyes on their care. And it's been really, really hard, some really challenging situations that they've shared, that team. And one thing about in long-term facilities is oftentimes it is those family members pre-COVID who noticed, hey, my mom has she has a sore forming, and they're the ones advocating. And so now that those family members aren't going in, those family members are just stuck and going through so much distress, sometimes leading to really horrific events and death, to just worried about mental health. And so I want to put that resource out there for caregivers is if anyone's struggling in the long-term care world, they can reach out to the Ombudsman program. I can somehow, after I'm done speaking, put that in the chat. And know that's an access. And an event coming up, we here at the Area Agency on Aging, we have a quarterly advisory council. I don't know if Leslie, you might come to those. We have an advisory council coming up where our Ombudsman program are going to give an update as well as talk about transitions programs. Atlantis Community Inc. Has a pilot program for expedited transitions. We here, one of my programs is a nursing home transitions program through Medicaid. So it's going to be kind of a more long-term care focus. So that's on November 17th. Is that next Tuesday? 2 Tuesdays from now? And I'm happy to share that too. And that's less, to be really candid, less veteran-centric, but very much on the older adult side or people with disability side. So if you're looking to connect in to those quarterly meetings, we'd love to have you. And my computer is so slow, otherwise I'd pull up more things that I could show you, but just a little snapshot of some of the things Dr. Cog's doing.
Yeah, Dr. Cog is a great resource. Thanks for that. Maria, would you like to talk at all about or speak at all about how COVID has changed caregiving through the hospice lens? And I know, Julie, you also are in hospice. And so maybe kind of opening it up to you two to see what you're seeing with our veterans and their needs for care, inpatient and home care, and what are the barriers that you guys are seeing in that?
Well, what we're seeing now is a lot of the facilities are shutting down again. You know, for a while this summer, they were letting more of our staff in, and now we're hearing more and more we can't come in. So our social workers, our chaplains, our nurses have been reaching out to family members and providing support to them that way, virtually, and able to communicate with them on an iPad or a go-to-meeting. But it's been quite a roller coaster, I will say, since March, because there was a time when things were opening up a bit, and so we were able to get our social workers and chaplains in there, and now I feel like we're backpedaling again, and it's really kind of heartbreaking. We're also hearing from families when a physician will refer their loved one for a hospice or palliative care. Families are very reluctant to have us come to the home and to meet with us, and they're fearful, they're very fearful. They're concerned about their loved one having to be admitted to a facility because they won't have access to them. So there's a lot of angst out there, a lot of folks really troubled right now, I would say. And, you know, we're doing the best we can to support people. And if they're willing to see us, we're happy to do that. But we're finding more and more that the doors are closing. And it's sad. It's very sad.
Yeah, this is Julie with Dignity Hospice. You know, when COVID started, we immediately had to change up some things, and we got requests from many assisted living communities to have a dedicated team. And so we have put those in place. So that allows us to actually still have that in-person connection. And then just following the protocols that change every single day. But in order for our social worker and for our nurses and our CNAs, and for a bit it was our massage therapist, and now even our massage therapists, they can go in as long as we have a dedicated team that only goes into that particular community. They can't go into a home, they can't go into a hospital, they can't go into another assisted living. So we have hired more people to be in our teams to be able to provide this. Another thing that we use, because there are also, just like Maria said, many communities that are they're limiting just to nurses coming in, full PPE, no other team members. And that sometimes changes daily. I am the receiver of all the emails and phone calls from executive directors, and then I have to put this information out to our team. And so one of the things that we found is a company called Serenity Engage, and that helps our team stay in touch with the families. And it's an online platform, and communities can actually use this. You don't have to be with Dignity, you can actually sign up with Serenity Engage. And we're finding that that platform, once we talk about how that is so useful to keep families, because there's so many places now families can't visit, they've closed that up, that's really helpful. But this is just a really interesting time. You know, you've got to be really flexible, I think, to be in this realm right now, you know. So I just say to everybody, just stay strong and just be willing to be flexible. Listen to the needs of a community and a family, and just try to see how much you can meet them.
Wonderful, wonderful advice. I'm looking up Serenity Engage. It looks like it's an app, and the wheel is just spinning and spinning and spinning. So maybe I'm just using a little too much bandwidth this morning. When that comes up, I will certainly pop that into the chat, but that's wonderful to know about. We all know about cell phones and iPads and things like that, but to have an app that can be so comprehensive, that's beautiful. Thank you for sharing that.
It's HIPAA compliant, so that's the pretty incredible thing about it. There's not a lot of these apps are not HIPAA compliant, so that was one thing we were seeking.
Yes.
When saying, hey, what can we do here other than telehealth? What else can we do to keep that connection with family members and their loved one and our team? So like they could just look at it and see who went and visited. We could take photos if they can't come into a community and send it. I'm not sure if they have a video piece, but I would encourage everybody to just look into it. I'm not trying to sell anything for them, but
no, but it sounds like
it's an amazing app, and it actually has been a differentiator out there. So something to look into.
What a wonderful resource. Thank you for sharing that with us. Yeah.
Heather, can I ask, are the long-term care ombudsman able to visit the facilities? Are they doing that now, or what's the status of that program?
Great question.
Changes every day. So what is the latest? The latest is they were moving towards outdoor visitation. I think they still are allowed to do that. The feedback that the ombudsman team give is that not really useful in the sense because you're out usually in the smoking area, and with the weather changing, of course, that's a factor. But so having private conversations is tough, and you still have to keep distance, and they're fully gowned up, and you're yelling. So not as helpful, but they do those outdoor visits when they can. They were looking at going indoor. They're not considered essential, so that's why they're not able to go in, even though they provide a very essential service. So nothing, they're not able to go in yet based on like governor's orders and whatnot and HIPAA. The recommendation was that you had to have a COVID test, and so that the threshold for like county community spread had to be so, it's not looking real feasible at this point for ombudsman to be going in. So relying heavily on virtual, but anyone who's called a skilled nursing facility trying to get to a room, oh my goodness, it's so hard to be transferred to 3 different desks and then accidentally get hung up on, and 20 minutes later you're just trying again. So changes every day.
Exactly. Maria and Julie, because you're both our hospice reps today, can you tell us about veterans in your within your hospice communities? Are you seeing any different responses from the general public? If that's the right question.
We're actually able to go in and do the pinnings, so we're really enjoying that. And so the communities that are allowing compassionate visits or for special occasions like this, we are able to do that, and we love that, and the families love that, and the patient loves that. So we're trying to get in and do that as much as we can. And then just, you know, trying to be connected with the veterans in any way possible. Yeah.
Wow, that's
a silly question. Hospice considered essential healthcare workers that can go in wherever they need?
So nurses can, CNAs can. You have to get permission if a social worker can, but we have nurses. We actually have veterans on our hospice team, so they're able to do the pinnings because they're already a nurse at the communities, or they can go into homes. Like I said, we just follow the protocols, and the communities are so embracing of us being able to provide that. So yeah, it's just a blessing to be able to do that in such a challenging time.
Absolutely. Well, that's great. It looks like we lost Colleen. I don't see her on the call anymore, unfortunately. Yes,
Mary, can I just share?
please.
We were really struggling with how to acknowledge and honor Veterans Day coming up. So I would love to hear what folks have to say. We did have an agreement with the Colorado State Veterans Nursing Home at Fitzsimmons to conduct pinning ceremonies and provide certificates of appreciation this coming week for Veterans Day. But now I'm hearing that the weather's going to turn next week, and so I'm like, I'm so concerned about that. But it's been a challenge being able to get into some of the VA contracted nursing homes and to be able to do some acknowledgement, some honoring of Veterans Day. So I'm wondering, is Dr. Cog doing anything? Is the VA doing anything, Brian? Because it's so scaled back. I've been doing this work now almost 15 years, and this is heartbreaking for me to have a Veterans Day like this. So I would love to hear what you all have to say about that. And Innovage, Leslie, I don't know what Innovage is doing for Veterans Day. So thanks, everyone.
Maria, that's a wonderful, wonderful segue. Here, let's go to Veterans Day. Oh my gosh. And my first thought, I'm just going to jump right in here, is that maybe you can collate the veteran members or the veterans who are in that nursing home, send a package with a certificate and a pin, and do a virtual pinning ceremony. How about something like that, if you're restricted? Leslie?
Oh, you're talking to me? I'm just listening.
No, Maria had asked about you and about what you might be doing for Veterans Day as well.
Well, I have been researching for a few weeks, and there's really nothing going on, hardly anything. We did find an event up in the Loveland area in Fort Collins that starts at 4 a.m. And our navigator up there is going to be there at 6 a.m. on his birthday, because I guess there's a whole schedule of ringing the bell. And so that's one that we found out about, and we can do that. He's going to have a table of resources, and then he has to leave. And then other than that, we heard about something at the Broomfield Senior Center. But I have been asking Nikki Garrett at the VA, and she sent me, this kind of more national activities list. But we're kind of running up too against the virtual, kind of like virtual activities. And to be honest, most older adults are not really savvy with the virtual, all the platforms. I mean, some are. So it's been really, we're really disappointed too, because we wanted to celebrate big. But yeah, so if anybody knows of anything, we would love to do that. It's just, has anybody heard of anything?
I haven't really heard of much, but I'm thinking about like the students and maybe like younger kids that live, maybe they could like mail in like a picture or something, or do like a drawing contest or whatever, and then they can submit that on social media. And if you have access to a printer, you could print off some of those or like make a little collage and put it on their door.
Yeah, we don't have anything planned at Dr. Cog either, which is, at the very least, we would always participate in the Aurora Veteran Salute. That was my favorite, which is always in November, but that's canceled. I think for our veteran-directed care program, we have about 100 vets that we're working with. We've talked about doing cards, mailing out cards. My program's been short-staffed for a few months, so they're kind of getting their feet back under them, but haven't come up with any genius ideas either. And Dr. Cog's open on Veterans Day, which I'm always mad about, but so we could do better, definitely here at Dr. Cog. I would love to hear more ideas. I'm getting creative.
At the VA, so we are closed for Veterans Day for outpatient services. So that means that it's kind of unfortunate in a way, because not many of us are here. It's just really the inpatient units that are still operating in the ER. I do know that the inpatient psych unit, I saw an email exchange where I think one of the nursing staff, there was a VSO that wanted to give some like pizza to the veterans on the inpatient psychiatry unit. So one of the nurses was going to come out, outside of the hospital to get all the food and then bring it up to the inpatient psych unit. And then they were going to probably have a little celebration on the unit, but it would be, done by the nursing staff, given that we're not having volunteers come onto the inpatient units at this time. Whereas in past years, the volunteers would come on and have much more of a festive event. So it would just be strictly done by staff this time.
Our volunteers are really suffering because they don't get their caregiving juju, They don't get the caregiver on. Since COVID came along, they really, the regulations have really kind of mixed the volunteers, unfortunately. So
I know, I'm sure that's hard for a lot of them.
Yeah, exactly. Last year at Lutheran Medical Center, we did do a veteran ceremony in the lobby. And then one of our Vietnam veterans who had worked with us with some other things, and some of our veteran staff went around and we pinned all the veterans who were in the hospital that day. So that was beautiful. That was just a wonderful thing. It sounds like it might just be a one and then maybe another one later, maybe after COVID. Or maybe just come up with something different for next time,
I just wanted to touch briefly on what Leslie mentioned earlier about older veterans or caregivers that maybe aren't really tech savvy. So I work on the virtual geriatric program, and one of the options we have is Telegero psychology support. And what has been created is a consult for a telehealth tech to contact either the veteran or the caregiver to help them set up even not just like a VA issued tablet or device, but also their personal computer, because that's something that, they acknowledged as well, and trying to just, break down those barriers to get that virtual support to them. So if you have any questions about it, you can email me, but you can also share that with any veterans you work with or families, and they can get more information from their a VA provider.
What would they specifically ask the VA provider? I've learned, you got to know what to ask for sometimes to get connected.
So their primary care physician should know about any kind of virtual support available, and any Telegero psychology support, or other ways for them to get virtual visits in their home versus coming to the VA.
Right. Specifically about that, they would know about the personal home computer help through Telegero psychology?
They should. Everyone has been given that information, but if not, you can, if you're working with somebody specifically that's running it up against any issues, feel free to email me.
Okay. I'm thinking of our veteran directed care program. We have a lot who are struggling with home stuff, not necessarily the VA platforms, but
yeah.
Can I throw out one more resource for caregiver support? We did receive COVID CARES Act funding to do reassurance phone calls. So despite our name being Area Agents on Aging, we do work with anyone over 18 and with a disability. And we don't verify anything, so caregivers can call in. Like, honestly, it's just kind of a free-for-all. And again, not veteran specific, so but anyone that needs just kind of that reassurance work and ongoing phone calls, we can do that here. I'll type the phone number in the chat. It's our community specialist, community resource specialist line, and that can also be used for just anything, for resources, referrals, if they want to get connected with our other programs like case management, It's kind of the first point of contact for anyone accessing AAA services here. And yeah, caregivers need that reassurance work too. I know they have a pretty high call volume there, so please use that too.
That's wonderful. Just lastly, I want to just bring up the topic of humor. There's a lot of humor that we can use in caregiving to help our caregivees and our caregivers cope and be a little more resilient, perhaps. I found this wonderful, fun book by Roz Chast, and it's called Can't We Talk About Something More Pleasant? And it talks about her experience about talking with her parents about how to kind of plan caregiving experiences ahead of time. What are those conversations we have, etc. And it just is fun. It's Roz Chast is an illustrator of cartoons for magazines like The New Yorker and so forth. And so some of these cartoons really just kind of hit home when you're in that caregiving role or you're a potential caregivee. Might be a nice way to bring up some of those caregiving conversations with the people that we deal with on a day-to-day basis. So, humor, as long as it's not self-deprecating or injurious. You have any good humor resources, Brian?
Netflix. There's lots of series on Netflix. Just finished Schitt's Creek. That was a lot of fun.
Oh yeah, I've heard so many things about that. I have. There was a movie a couple years ago called Robot and Frank, and it was about Frank was a cat burglar, a retired cat burglar, and his family, who visits him by video every day, got worried, and so they bought him a robot, and that was a fun video.
I can see that.
Yeah. But just different ways to talk about caregiving and the struggles of caregiving. I think that's what our caregivers need.
There was a really good one I saw recently on, I think it was Amazon Prime, called, I'm probably screwing the title up. I think it's called He Won't Get Far on Foot. Has anybody seen this? That's Joaquin Phoenix. I probably am messing the title up and you won't be able to find it.
Just the title's funny.
Don't worry, he won't get far on foot. Really good. It's about what's the guy's name? A famous cartoonist, John Callahan, who did kind of edgy cartoons. He had I don't want to like spoil the whole movie, but he did have a disability, and there's like caregiver and like mutual aid support groups, and his sort of using the cartooning to as sort of a healthy outlet for himself. It's just a really good story about his recovery journey. Yeah, check it out. It was really good.
Did anybody see that show? It was out a couple years ago. It was with Michael Douglas and another older guy, and it's about them aging, and it's hysterical. And I think it's on Amazon. I mean Prime. Yeah. Anyway, it's another funny one.
I've been watching dumb reality TV. I don't recommend it, but it gets me through. My favorite's about super yachts on Bravo, and I pretend I'm in the Mediterranean.
Oh. Oh man, I could use a beach right now. That's Mary.
Yeah, it's beautiful. I've been collecting beach memories for all of you. I share them all with you.
That's great.
Yeah.
Where are you in Hawaii?
I'm on the Big Island of Hawaii, and they just opened up Hawaii again to tourists. If you have a negative COVID test, and then you get another COVID test here, and they have, unfortunately, we're uncovering people who come to the island who are positive for COVID, despite their negative test 3 days ago. And there lies one of the problems. But really, it's amazing. The beaches here, this period of time where COVID has limited the human impact on the beaches, it's kind of amazing because the water is more clear and the sea life is kind of coming more up to the shore. I got an opportunistic sting from a black sea urchin that usually the sea urchins are farther out because there's so much activity and so many people that they don't have a good resting spot. So yeah, it's neat. And people have had time to pick up all the garbage, so there's less garbage on the island right now.
Wow.
Yes, but it's just so boring every day, 80 degrees. What are you gonna do?
Can we throw something at you?
Sure, anything you like, I'll catch it. Anyway, thank you all for participating in this call. It's been wonderful. Do you have a way, Heather, of kind of copying the chat and sending the chat out? Or Courtney?
I do.
Okay.
I think I can grab everyone's emails from when you logged in, and I'll send some supporting docs. And then Courtney, we've always put this on the website.
Yes,
the recording will be made available there.
Yes, the recording and then all the resources will be on our VCP website.
Good.
That's wonderful. Thank you all
Thanks.
for participating. This has been a wonderful discussion.
Yeah, thank you, everybody.
Nice to see you all.
Thank you, Mary. Good to see
All
you.
right.
Yeah, take care. Bye.
Thank you.
Bye.
Bye. Thank you so much.
Thank you.